Hi, this is Pamela Worth with the Encourage Your Wellness podcast. And today I have Dr. Cheryl Burdette. She's a director of education at Progressive Medical Center, which hosts the Naturopathic Residency at one of the largest integrative clinics in the Southeast. She's founder of Precision Point Diagnostics and is not only an expert in gut health, but so many other things. Welcome, doctor.
Thank you. Thanks for having me.
So tell us a little bit about how you got into your role when you learned to become a doctor. Obviously, there's so many things you can go into. Tell us how and why you chose where you are and what are some of the exciting things you're working on and what's coming up.
Yeah, absolutely. So way back in college, if we have time to go back that far, was where my interest in integrative medicine began. And I was dual majoring in psychology and pre-med. And I thought, surely these disciplines must be intermingled somehow. Is there a type of medical discipline that combines mind and body? And at the same time, one of my last classes in psychology was this really cool class called Biofeedback, Self-Regulation, and Meditation. And I did experiments with college students, and we would bring them in and put sensors on their fingers, and we would measure their body temperature. And then we would give them what's called biofeedback, something outside your body that's giving you feedback about you, bio, life. And so they would see little blocks that would change colors and increase in size if they were taking their body temperature either up or down. And they got $1 for every degree they could move their temperature either up and then back down. Any degree change earned $1 within the session. So as people came in week after week, they got really good at taking their body temperature up a couple degrees, back down to normal, down a little bit. They could really control this function that most of us would think would be completely outside of our control. And while body temperature might seem a little, academic, it turns out you can apply that kind of strategy to controlling things like blood pressure or anxiety, or they make really cool biofeedback devices with planes for people with, for example, attention deficit disorder. So the kiddo can focus on getting the plane to fly and not crash, and you get into certain brain waves when you do that. So it really impressed upon me this mind-body connection. And from there, it was long enough ago that there was no real internet to go to. So I went to something called the Peterson's Guides. I looked to see if there was integrated or natural medicine. I found this thing called Naturopathic Medicine, and I picked up my bags and moved out to the West Coast to Seattle, Washington, where I got my degree. From there, did my residency at cancer treatment centers, and then came back to the South, Progressive Medical, to really try to bring integrative medicine to an area that had less exposure than maybe Washington or California, where I'd been.
Awesome. Well, that's a lot. From there, what have you found about the gut? What do you find that is really important for you to continue? That's kind of like a known thing. Maybe some people understand, maybe some people don't. How and why is the gut really becoming so much more of an emphasis now than it was, say, over a decade ago?
Because of the science that comes forward. And that's always been really important to me, to make sure that we're following evidence-based types of recommendations. And so just as important as finding something that's natural or a functional medicine or a naturopathic medical approach that works, to me, is ruling out things that aren't efficacious. So I've been lucky enough to practice at Progressive Medical. It's a large integrated clinic, 20 practitioners under one roof, MDs, NDs, dietitians, chiropractors, all of us working together. And so that clinic has been around for about 30 years now. So very active place, got to get to see lots of patients. And from there, because we're so large, seeing so many patients, we also then decided to start our own laboratory. So we birthed Precision Point Diagnostics out of the clinic. And the reason for that is because we were were really interested in some of this gut-based approach to what happens in the body, but couldn't always find the lab testing that would match what we needed. So we're particularly interested in this area because it's such a huge area of opportunity. If somebody has been in pain or experiencing inflammation or various headaches or a decreased quality of life, we might think, okay, well, to get out of pain, that's an anti-inflammatory. Maybe that's a steroid. And for sure, that is one approach, but it happens to come with pretty significant side effects. So what we see through gut-based interventions and gut-based practices, and what I mean by that are changing diet and various probiotics and various amino acids, and we'll get to that part. But those gut-based strategies have as much potential and as much strength as an anti-inflammatory as something like a prednisone or a steroid does, but without the side effects. So it gives us a way to calm this inflammation without a reliance on medications that really are just should be used more short-term, not over and over again. And it gives a pathway for people to treat the root cause of what's going on, because behind a diagnosis like depression, behind a diagnosis like anxiety or even pain is something that's creating inflammation. And gut-based inflammation is one of the largest sources of that. And so if we can change the foods that we're eating, if we can change an inflammatory microbiome, we have this opportunity to change that terrain. And I talk about how gut is our first interface. It's this area where we're going to interact with the outside world with foods and nutrition, and that there's going to be this opportunity to either accept what they give us or to become reactive to what it's seeing. And so it is literally a huge opportunity. The gut is the size of a tennis court, so a huge opportunity to change the way that we interface with the outside world to make our internal selves healthier and less inflamed.
Yes. So, and in my journey with my son, the doctor had explained to me that we needed to fix his gut. And this was over 10 years ago. And so that was kind of a wild thing. I was like, okay, well, I'm not quite sure what that all means, but, sure. And the doctor says, well, his body's inflamed. And so we need to reduce the inflammation, because the inflammation is really housed in the gut. And that helps control what's going on in the brain, as well as, your immune system and the rest of the body. I'm oversimplifying things, I know. But, when you first take a look at how am I going to attack inflammation, I mean, you can't get rid of every single inflammatory thing in your environment. It's so hard. Do you kind of have a particular place that you like to start with people?
Yeah, absolutely. So I think that a large amount of ground can be gained. And, back to the example of your son, a lot of us have difficulty wrapping our brain around, no pun intended, how this connection to the gut really works. And that's because we're all brought up in this more reductionist style of medicine, where we look at the heart and that's a compartment. We look at the liver and that's a compartment. We look at the brain and that's a compartment, but not at the interactions. And it turns out there's a very significant interaction between the gut and the brain. And there's a communication that happens that's driven by gut bugs. And those bugs are bacteria, and they can either be bacteria that are good for us. And if you took it externally, you'd think of that as a probiotic, taking bacteria that's good for us, or there can be bacteria that's bad for us. And we'll group those and call them dysbiotic bacteria. And so that bad bacteria puts out signals, and particularly they shed these things called lipopolysaccharides. And that sends a signal. It stimulates particularly of the vagal nerve, and that's a nerve that communicates from the brain to the gut. But 80% of its communication is from the gut to the brain, only 20% back down again. So if we're shedding these lipopolysaccharides, that nerve sends a signal to the brain that says, game on, there's a war going on. Let's be inflammatory. Let's pull more white blood cells to the area. Let's create this fire that's designed to kill this pathogen. And that's okay when it's something that gut is more of an acute infection, an immediate infection we need to get rid of. But what so happens in this day and age is there's so much assault to our good, healthy flora, and that can be from a sugary diet. That can even be from a diet that's too fatty, but that can be from all the chemicals that are in our food. That can be from medications we take. That can simply be from being under more stress, because stress decreases blood flow to the gut. It puts us in fight or flight, not in that branch of the immune system called rest and digest. So we've got this battle going on. It sends a signal to our brain, and in our brain, inflammation is created as well. It directly causes various cells in the brain, microglia, astrocytes, to become inflamed. And that inflammation blocks the ability to make certain neurotransmitters locally in the brain. So neurotransmitters like serotonin or dopamine give us a sense of well-being. GABA gives us a sense of relaxation. We are no longer as good at making those neurotransmitters, and we start to make other ones that are more neuroexcitatory or cause more aches in the body. And you might think, well, this is really weird. Why would this happen? And the reason is evolution. If we were going to have this conversation a few hundred years ago, you would be much more likely to die from what we would call dysentery, which is just, diarrhea over and over and over. And so because of that, we are wired to respond to what's in the gut. You get an infection, it starts in the gut, it sends a signal to the brain to say, I don't feel good. Get away from the tribe, go to the back of the cave, don't infect the rest of the people. And so that had its place when we were all more likely to die from dysentery. But now, fast forward, so much assault to our good normal flora that would usually compete with this kind of lower level dysbiosis, as I'm calling it. And then, and so much opportunity now for an imbalance to occur. So for many of us, we're fighting this fight in the gut that directly changes the neurotransmitters that are made in the brain. And it's a really underexploited way of treating. Everybody knows that if you were 9 out of 10 times, if there was somebody was going to treat a depression or anxiety, they would likely start with medications known as SSRIs, selective serotonin reuptake inhibitors. And those can be game-changing for some people, and they can absolutely be a bridge that gets somebody to where they need to be. But what's the reason they're not producing enough serotonin? And that is often back to the gut. So now we change the microbiome, we change the serotonin that's produced in the brain, and we create a platform for somebody to be able to get to a point where they're able to back that medication down, where they don't need the external support anymore. So it's not that these medications are bad, they're good, they have their place. But we also want to ask the question, why is this happening in the first place? And when we get back to what's going on in the gut, that is often the reason for some of the change in neurochemistry that we see.
So, and I think that's awesome. I'll kind of give an example, and then I'll ask a question. So when I was in college, I was feeling kind of down. And so I went to student health, and they had me start taking Prozac. What they didn't ask, and that I probably should have shared, was that I was drinking too much beer and eating too much pizza. And my theory is now, when I eat a lot of that stuff, I feel really crummy. How much of this can be fixed by removing inflammatory foods for a period of time, such as gluten, dairy, high chemical foods? Maybe those need to be more organic. And inserting things like prebiotics, probiotics, or do you really need to start with a test and go from there?
So I think the literature is pretty strong in this area in terms of dietary change, and you will see positive outcomes in terms of depression and anxiety from studies where they look at just removing processed food, or different studies that look at increasing fruits and vegetables, other studies that look at removing dyes and chemicals. And in all of those areas, you see positive outcomes. So for anyone who's struggling, I would absolutely start there. for most of us, we could always work on getting more vegetables in our diet. We could just think about what you had yesterday, and the recommendation, and to me, this is the bare bones recommendation, but is 5 servings of fruits and vegetables a day. And so for most of us, if we really keep track of that, we're not really hitting that mark. And so I would encourage anybody who doesn't feel well to make those changes, because data is favorable that will be helpful. Then from there, if you're seeing that you've got some improvement, but you're not quite where you'd like to be, or you want to dig a little deeper and know exactly which thing that you removed was helpful to you, this is when testing becomes useful. So yes, do the standard things that would, and when I say standard, it makes it sound easy. It certainly isn't, but the things that we all know that we should be doing, the 5 fruits and vegetables, 30 minutes of exercise 5 times a week, that's another thing that has really good data in terms of improving focus and concentration. And it's another evolutionary thing. That exercise, we are wired for that to affect our brain, because when you would go hunt and gather, that's when the brain needed to be turned on the most to really see the deer, to see the berry, to lock in on what we needed so we would survive. So people got, so we became wired so that when there's movement, your brain works better. It increases something called brain-derived neurotrophic factor. And so these foundational pieces, diet and lifestyle, really do matter. But for many of us, we can change our diet and still not see that improvement that we would hope. And so then having something that says, for me, what foods are creating inflammation? Because unfortunately, in this world where our immune system has gotten confused, where it's fighting bugs it shouldn't, where it's had so much assault from sugar and bad foods, it gets confused, and it can even start to attack healthy foods, which creates inflammation. So for example, my colleague, Dr. Agoli, recently, a patient was running after him in the parking lot. Oh, thank you. It changed my life. And he's like, oh, okay. Well, what was it that happened? And she was explaining how her quality of life was so much better. And the thing that changed was she took broccoli out. And on face, that seems so backwards. I mean, we know broccoli is healthy. It decreases risk of cancer, and it has antioxidants. And you're 100% right about all of that, anyone who's thinking that. But it turns out for this person, her immune system was confused and attacking it, which was creating inflammation. So sometimes even healthy foods can be the culprits. And so that individualization could be useful. But I don't want that to be ever taken as, well, I can't get to a test like that, so I guess it doesn't matter. It does matter. The literature is very clear. More fruits and vegetables help. More exercise helps. Less processed food helps. And so those are basic starting points that are effective for a large part of the population.
No, I think that's awesome. And the exercise is really big too. Whenever I exercise, sometimes I find myself smiling. Like it just, not everybody feels that way, but it makes me feel happy.
Especially when we're done.
Yeah, true. In your research, how long, because I can tell you from our experience, it took about a year to flip our son's, gut around. In your research, do you find that there's a certain time period or a certain average time period that it takes most people? Because it's frustrating, or it was for us when we were going through it, that we needed to be patient. And is that typical? Is it not typical? Do you have any research around that?
Yeah. So when somebody has a more extreme and or more chronic condition, it often takes that time frame that you're suggesting, that 6 months, 9 months, even a year, to really see the full change that we're looking for. Now, let's take somebody that maybe has noticed just a drop in energy. They're not quite themselves, maybe a little fuzzy, focus isn't quite as good. That person will probably notice a good amount of improvement with even 3 months. But I would still encourage someone to stay with those gut-based practices. And you'll likely be working with a clinician when you do something like that. And it's probably going to be more aggressive initially, but then you're going to back things down into more of a maintenance plan. That's kind of the flow of this, but still staying with it for likely 6 months, a year when somebody's more chronic or when it's a more aggressive condition, because what we're really trying to do is get the immune system to not be confused. And that takes at least a couple steps. First is the removal of whatever's causing the immune confusion. And when we're talking about the gut, that's likely to either be a food or a bug. So 2 tests that I'll often start with are looking at food sensitivities and then looking at stool testing that tells me about the microbiome. Then from there, changing the diet, working on shifting the microbiome, and working on calming the immune system down. And to really calm the immune system down, that's the part that takes a bit longer. That's more your 6 to 9 month time frame. And I liken this to, if you think about, if you ever known someone who's done desensitization for allergies, and they do those by injections, well, you'll recall that that length of treatment is usually a year, even 2 years. And so again, the idea that to really change how the immune system is interfacing with the outside world, it takes a while because you're retraining it. To really change the health of the gut, you've got to build that tissue. So I always tell people, just like you don't get to go to the gym once and have beautiful biceps, you don't get to take your supplements once or twice and have a nice, robust gut lining. So it takes some time, it takes some patience. And also just a reminder that it's not suppressive medicine, which is more what standard of care is. And so we suppress the symptom, and we're very good at that. We've got great medications for that, and there's a place for that. If somebody's in horrible pain, we need to suppress that symptom. Even that prednisone I gave the example of, if somebody's having something like what's called colitis, and so their bowels are inflamed and they're having 20 bowel movements a day, not only is there no quality of life, but the inflammation can cause scarring, and then you don't absorb. So there's a time and place for it, but what are we going to do so we don't need it forever, and so we don't need it again and again? And again, training that immune system does take some time. It's not immediately suppressive. Think of it more as like growing a garden. We've got to, or building that bicep. It's going to be something that we're working on every day, and it happens slowly over time.
And when, thankfully now we are starting to see more and more tests coming out. There is some conflicting information out there. And so when you, in your experience, when you're testing the gut, does it always have to be by the stool and you can just test some of the inflammation or some of the immune system function through blood? Do you find that you need to do a combination? Is there anything that can be done through saliva or urine? It's, kind of interesting to think about some of the options.
Yeah, absolutely. You're right. There's a lot out there. And I will use all of those, but it depends on the question that I'm asking. So I really like saliva for example, our adrenals. And those are little glands that sit on top of your kidneys. They make your adrenaline. They make your get up and go. So when people are having issues with energy and I want to measure their function, that actually shows up best in saliva. If I'm looking at, for example, metabolites, and so, for example, the way people metabolize estrogen could either increase their risk of breast cancer or decrease it. Well, metabolites show up best in urine. So then I'm reaching for urine. So specimen really depends on what we're trying to look at. And so I mentioned that 2 pillars that I love for gut-based inflammation are a food test, and that's generally done through blood. What are the foods you're most reactive to? And a stool test, which is done through stool, fecal matter. And that's what are the bugs in your gut. And so do we always have to do both of those? No, it's perfectly reasonable to say, I'm going to start with one, see what kind of change I get, and then see if I need the other. But also sometimes clinically, we're working with someone that might be having more aggressive symptoms, a lot like you were facing. And so we really want to change that as quickly as possible. And in that world where we want to calm down inflammation as quickly as possible, is it a bug? Is it a food? If we can know both of those at the same time, we move forward a lot faster. because conversely, if I only know one and the other is still there irritating the gut, I'm having to work harder to build that gut lining back up. So even that is individualized. Where's a person at? How many symptoms are they having? Logistics financially, of course, we have to fold that into, and how aggressive are they presenting to make a decision. But my two favorite are a food test and a stool test.
Okay. Now back to food sensitivity, because I've gotten into arguments with other parents about this. The blood food sensitivity test versus the back scratch or the back.
Okay. Yeah. So that is a fuzzy argument, and I'll say it this way. So the test that we do actually looks at all of that, but you don't have to poke a person to get that allergy. So when you poke someone, that scratch test, you're looking for allergies, and those are mediated by a part of our immune system called IgE. And so IgE are these immediate reactions. You eat something, your lips swell. You eat something, you immediately get a headache. You eat something, you have shortness of breath. And so that can be done two ways. Either by that scratch, like you mentioned, or by blood draw, and they correlate pretty well. So to me, the issue is not, is it serum or is it scratch? To me, the issue is that's allergy, and that's just one part. And I would encourage people to know that for sure. But then from there, what we've learned is that there's multiple ways the immune system reacts to foods. And it's not just immediately. It's not just one time. And it is, and again, if you were saying, what's the research or the evidence about this 20 years ago? PubMed is where most of the peer-reviewed research is. And if you went there, you probably wouldn't have seen a lot of studies 20 years ago. But now when you do the same thing, hundreds and hundreds of clinical studies that correlate IgG sensitivities with symptoms like anxiety, depression, migraines, gut pain. And so what we've learned over the past 20 years is that there's different parts of the immune system. There's different ways it reacts. It can react immediately, and that's one part, but it also can have a delayed reaction 3 to 72 hours later. And this can be really helpful with the testing because think about that. You have a bad day, you get the headache, you can't focus, you think, what did I have for breakfast? And it's really what you had for breakfast a couple days ago. And that gets hard to sort out. So this IgG testing, that argument about it's not supported would probably have been correct a couple decades ago, but that's just really not the case anymore. And so in the same way, in terms of like cardiovascular disease, you would want to know both good cholesterol and bad cholesterol because they tell you very different things, LDL, HDL. You would want to know, am I having immediate reactions or delayed reactions? But just knowing one or the other wouldn't really be enough. So I think both have their place. Both are good, and knowing both really helps people get to the finish line more quickly.
Well, and I think another interesting thing to think about too, and the way this was explained to me is if something shows up in the blood test, but not in the scratch, it could be that provides a low grade inflammatory effect on your body. And there's incredible evidence growing in that these low grade inflammatory responses within your body can lead to long-term major illnesses later in your life. Not only, the short-term depression, anxiety, but, these longer-term Alzheimer's, other brain disorders. And so, I'm not sure what kind of research you've done in that area, but certainly something that I think a lot of us will want to keep an eye on.
That's 100% correct. You have to get to a pretty high level before you see this immediate symptom. And so just like you said, there can be this subacute inflammation that's going on that it gets harder to associate with a particular food. So the testing can be really helpful there to make sure low-grade inflammation isn't occurring that can create this ongoing stress to the brain.
Yeah. What else have I not asked you about that you want to share?
I think that this really opens up a lot of avenues for people because a lot of times people have tried various medications in terms of modulating neurotransmitters, or they've tried other ways of getting out of pain. But I don't think that you're fully out of options until you've really explored gut-based health, because it has so much potential to calm down inflammation, and that inflammation can can decrease neurotransmitters in the brain, but that inflammation can also leave us in more pain, cause more fatigue. It can even be a reason for weight gain. So it means that there's this whole other avenue of going about something that can really put people in a place where they feel more well. Also, I think that for a lot of us, it's empowering to know what we can do when we change our diet, and just like your experience in terms of, okay, maybe those weren't the best food choices for me, but even if here and there you eat a piece of pizza and you know, okay, that's the way it's going to make me feel. At least it's not this giant mystery out there, and we're unclear about what's going on in our body. So I think having a tool like change in diet that's under our control can begin to give us some stability, not just physically, but mentally, in terms of, yes, absolutely, there's something I can do about this.
Thank you, doctor. And if someone wants to talk to their physician, or they want to find a physician that might understand what some of this may mean to really get to their gut health, do you have any suggestions on where to find a physician, or what kind of physician someone should ask about?
Yeah, well, like I mentioned, I co-founded a lab. So if you're looking for someone who uses that style of testing, you can reach out to us at precisionpointdiagnostics.com, and we'll put you in touch with a doc in your area. Otherwise, there's some other good sources to find people that walk this walk and talk this talk. I would suggest the Institute of Functional Medicine, IFM. They have a really good resource base to look for people that are integratively minded, as well as the AANP. That's the American Association of Naturopathic Physicians. Naturopathic.org is where you'll go to find people that have gone to 4-year medical schools, done residencies, passed boards, and who are licensed as primary care physicians in their state. So there are more and more of us. We're still a minority, but there are ways of finding people, and likely there's somebody in your area if you look at one of those organizations. And like I said, we can help you out at the lab too at Precision Point.
Super. Thank you so much, doctor. We really appreciate having you on today.
My pleasure.